This is When the Fuck Did I Become Old, the fun, edgy and unapologetically honest podcast about the experiences of aging, where, as the name suggests, nothing is off the table. And I'm your host, Jo Parker. And today I'm joined with Dr Maja Schaedel, who is a clinical psychologist from the Good Sleep Clinic who works with the BSSAA, which is the British Snoring and Sleep Apnea Association. And we are talking about National Stop Snoring Week, which is next week, 27th of April to the 3rd of May. Welcome to the show.
Hi, Jo, and thanks for having me.
You're welcome.
It's a really awful problem, snoring. You know, it's one of those things that I get talked by patients about it all the time. So I have patients in my clinic, so I work in the private sector and also in the NHS in sleep disorder clinics.
Right.
And one of the things that is such a big issue is not just your own experience of snoring and how that disrupts your sleep, but actually that of your partner's. And it's one of these really difficult things because, you know, you want to be able to share a bed with someone, you want to be able to kind of actually continue that relationship in that way. But what do you do when actually someone has a really bad snoring problem? And,
so do you tend to see more people complaining about their partner snoring and they can't sleep or the other? Or
yeah, actually, I would say that is a huge proportion. So, you know, we know that there are lots of sleep problems in the population. And what we tend to find is that you get a combination of people who have snoring and what we call obstructive sleep apnea. You know, that's another sleep disorder which actually stops us from properly breathing, really. And it means that we don't get enough oxygen to the brain. And we have these short little apneas, which mean that you kind of almost stop breathing momentarily. And then you can kind of have almost like a little sort of snorty snort when you wake up, like a kind of snuffle.
Is that when you're lying beside someone in bed and you think you've stopped breathing completely?
Exactly. And actually, there is a problem with sleep apnea because it can be a significant problem, which then can actually impact on our longevity. So if you do think that, you know, that's a problem, it's better to get it checked out. But snoring is just so common. You know, it's one of those things that we you know, you'll speak to someone and that you'll always know someone who snores because you'll often find their partner will be complaining about it. Generally speaking, people don't seem to be that bothered about their own snoring. It's always the partners who tend to find it most disruptive, as you can imagine.
Well, yeah, because if you snore, in theory, you don't wake yourself up, do you? Whereas if somebody is snoring beside you, that wakes you up or keeps you awake.
That's it. Yeah. And, you know, I think it happens at different points. So sometimes people snore from, you know, throughout their life. It does seem to be something that can be associated with getting older, putting on weight. We know that women in the menopause also are more likely to struggle with sleep apnea as they get older because of the way that their apparatus in their throats change and the way they store fat changes.
You're kidding.
No,
oh my
I know.
God. So we're more likely to snore as we approach menopause.
Yes, I know. And it's so depressing, isn't it? It's just another thing. But I think I would say that the biggest problem I hear about in my clinic, it tends to be women who are saying that their partners, their husbands are snoring. And so it is seen to be more of a male difficulty, but you'd be surprised at how many women snore as well. Yeah, it's across the board.
Right. For people who are having problems with their partner snoring, what do you do?
Well, this is a really interesting one. And I often find that you've got to get both partners in the room to really ask them what they think the problem is, but also what's important to them. So for a long time, I think we had real shame and stigma around the idea of sleeping apart. You know, it was seen to be like there was something wrong in your relationship.
Yeah,
you know?
The beginning of the end. Yeah.
Beginning of the end, like almost like you're seen to be some sort of ye old English couple who have separate beds and, you know, you can't sort of sleep in the same room and reduced intimacy. And actually, I think that really is starting to change. And I certainly talk to people about do what works, you know, because actually sleeping in separate bedrooms can be a thing that saves couples and their relationships, you know, often, because actually when you're getting good sleep, you're in a better mood, you feel much more like you want to hang out and feel affectionate towards your partner. And I would say you'd be amazed at how many people get really angry with their partners when they snore, because of course, you know, if you can't sleep because your partner's snoring, it's infuriating, you know. And so I think that if you're finding that in the relationship that it's causing tension, it's definitely worth thinking about sleeping separately. It's not the only solution by all means, but you know, another thing that you can try, it might be about the position that they're lying in.
I can just sort of, I don't tell everybody, but when Kev snores, I can just sort of like gently move him or suggest that he lies on his side and he's okay. But I think actually, to be honest, it's me that does the most of the snoring.
Right, yeah. Well, and is he bothered by it in the same way?
No, not at all, not at all.
Well,
and I have no idea how loud I am. I've no idea.
Well, you know what? It's really interesting you say that, because I think some people are bothered by it and some people aren't. Yeah. And I honestly think if I was to do any kind of research study, it would be on people who sleep poorly, and I would look at their partners, and you'd be amazed at how well their partners sleep. And it's the most infuriating thing, isn't it, when you've got a partner next to you who's sleeping soundly,
snoring,
and you're awake. And if they're snoring, it makes it doubly frustrating.
So that's an interesting point, actually, because you say that majority of the people you talk to are the women who complaining about their partners. And then prior to that, you said that women, especially as we approach menopause, don't sleep as well. And obviously snore, but don't sleep as well. So do you think that it is because we women don't sleep as well as men, and therefore if we're lying beside somebody who snores, it bothers us? Because if we are awake by any other cause, we can't get to sleep, we've got a partner lying beside us snoring, that really doesn't help, does it?
Absolutely. I think you're so right there. That's one of the main things that happens, because I think women's sleep does become more fractious as they get older, and certainly through the perimenopause, we know that really shifts. And I think if you are awake for any reason in the middle of the night and you've started to become aware of your partner snoring, it's so hard to then get back to sleep. And then I think what happens is our minds click on, don't they? And we start to think, hang on a minute, how am I going to cope tomorrow when I feel so rubbish on just 4 hours sleep? Or how am I going to be able to be productive and do everything I need to do? Or I'm going to look rubbish and I need to do this thing. And I think that there's so many concerns that we can then have in the middle of the night. And, you know, it is that sort of problem is often seen in what we call insomnia, you know, which is that struggling to fall asleep or even to stay asleep throughout the night. And that can go hand in hand with obstructive sleep apnea. So it's quite common to see obstructive sleep apnea and insomnia together. But I think when it comes to sleep apnea in women, one of the most difficult things is that actually women don't tend to display the same symptoms as men. So snoring is one of the main symptoms of sleep apnea in men. But with women, it's often other things like tiredness and lethargy and just feeling really exhausted the next day and maybe having a dry mouth. But we don't necessarily snore and we don't have to be overweight. Whereas in men, the big risk factors are things like being over 55, being male and being overweight are three of the main things.
Oh, wow.
So I think it's
not fair.
No,
it's just not fair. So
not fair.
Do you think, in your opinion, then, that if I'm not sleeping, I'm more prone to sleep apnea? Or
well, they kind of go hand in hand. I would say more the other way. So say you have a difficulty with snoring. And if you've got a partner who's kind of waking you up and saying, you know, stop snoring, that will disrupt your sleep.
That'll be annoying. Yeah.
But if you have obstructive sleep apnea, and you might not be aware of it, but it might be disrupting your sleep at night. So it's really common for people to momentarily wake up at night without realizing quite why. And the reason we tend to wake up if we have obstructive sleep apnea is because we're not getting that oxygen. So we wake ourselves up in order to breathe.
Oh, wow.
Okay. And so then you're awake. And then as soon as you're awake, that's when the insomnia kicks in. So it tends to be that you might initially have a sleep breathing problem, and then you might find that you develop insomnia as a result. But this is why it's so helpful to be aware of it, which is, and I've been working with the BSSAA to kind of really think about how to support people with snoring and sleep apnea. And it's great that we've got this National Stop Snoring Week, because it brings awareness to it,
And also it makes it less embarrassing, because the more people who snore and it becomes kind of like more commonplace, the more you're more likely to talk about it. And also, if people are saying, hey, you know what, he snores, I snore, we sleep in separate rooms and we're still intimate and we haven't lost, and it's not the beginning of the end, it's actually making the relationship better because we're both getting a better night's sleep. That's okay too.
Absolutely. And I think, often there's a tension that leads up to people sleeping in separate bedrooms. But I've also met people who've said to me at conferences and workshops, they've said, as soon as we started sleeping in separate bedrooms, our sleep improved and our relationship improved. And I think, we've got to be really open about these things, because actually, our relationships don't have to rely on us sleeping side by side in a bed, at all. There are some other things that you can do though as well. One of the things that you tend to find is that you might be more likely to snore on your back if you're lying on your back. I don't know about you, but I actually love sleeping on my back. Exactly. But we know that you're often, not always, but often less likely to snore if you're on your side. And so back in the day, we used to suggest taping a tennis ball to your back under your bedclothes so that it would stop you from rolling onto your back. Well, yes, I suppose hopefully if in your sleep you're not completely aware of how comfortable it is, but it might just keep you on your side. But nowadays there's all sorts of devices that you can buy on the internet.
They're slightly more comfortable than that.
Yes,
exactly. Sellotaping something to your back.
Yes. But there are other things that kind of get in the way. So we know that alcohol can tend to make it a bit worse as well. So sometimes I suggest people having their alcohol a bit earlier in the evening. It's all about cocktail hour, Jo. 5 o'clock, 6 o'clock. Steady.
Cocktail hour at 3 so I can sleep.
Yes, the doctor told me so.
I've just been told.
But actually, I think, actually that makes it, I think that's the most enjoyable time to have a drink anyway, because then you get to enjoy your evening, but then
at the end
you give
of the
yourself...
work.
Yes, exactly. And then you give yourself a chance to process the alcohol before you go to bed. And then it means that you're a little bit less likely to snore as well.
So the BSSAA say there are various types of snoring, which I didn't know. Can you explain what types there are?
Yes, there's quite a few, actually. There is sleep apnea, which we've talked about. There's also nasal-based snoring, there's tongue-based snoring, there's mouth breathing, and there's also kind of multifactorial snoring.
Wait a second. Sleep apnea, tongue, nasal,
mouth,
multi.
And then kind of, multi, exactly.
Wow.
But the sleep test that you can access through the BSSAA will help to identify what that is. And that just gives you a really good sense of what might be going on. But, really you can take that to your GP and show them. But do always, seek medical advice if you suspect that there is a problem, because it's good to get it checked out and treated.
So you won't necessarily know which type of snoring that you do?
Well, you might have a sense of that, actually. And often you do get people who say, I sort of do this particular thing and I think it might look like this.
Right.
But other people are completely unaware because they're just being told by their partner that they snore, So it's good to get it checked out. Yeah.
And if I do the test and I understand what type of snoring I do, are there any lifestyle changes that I can make immediately to? Does each type of snoring have a different lifestyle change?
A lot of them have very similar, because it's often about, if, for example, if you're overweight, so it's about making sure that you've got the right support in order to kind of have a healthy lifestyle and diet. So those are the main things, but also it might be in terms of, like we've talked about, positioning of your body, at night, and how you're sort of lying, and also even things like how your head is on the pillow, and is it better when it's inclined or a bit flatter? So it's worth kind of trying out these things. But generally speaking, a lot of the same advice would apply to a lot of the different things that you've got going on.
Fantastic. So the advice really is do the test, find out, and possibly seek professional advice.
That's it.
Interesting. So if somebody thinks they're snoring, or has been told they're snoring, or thinks that they might have sleep apnea but not sure, but they are waking up knackered and they are not sleeping, they know they wake up during the middle of the night and they possibly have a dry throat, what are the next steps? How do they find out, one, whether it is sleep apnea, two, whether or not and two, how they can avoid it? And of course, we haven't mentioned the fact that at a certain age, the hormones have a big part of this not sleeping as well. So if I've got a problem, well, I do have a problem, and we'll be talking about sometime else. But if I have a problem with sleeping, what do I do?
This is, really good question. And I think it kind of depends on what the problem is. So, actually the BSSAA have an interactive sleep test that you can do to kind of actually see, is snoring a problem? Is this actually likely to be getting in the way of my sleep? So you can have a look at that. And it's really useful, I would say, just to go to your GP and actually say, I think I might have an issue with this. And what they can do is they can do a referral to a sleep disorder centre. Right. And often what they will do then is they might do an assessment and then they might give you something to wear and take home.
It's not one of those masks, is it? That looks like you come Darth Vader.
Well, you're right about that. That's the treatment for sleep apnea. And they are, I know, it's really hard because there are all sorts of new treatments being developed, but that is still the number one. It's called a CPAP.
My friend's husband had one, and it sounds terrible as well. It's like, it's Darth Vader, isn't it?
It is a bit like Darth Vader. You're absolutely right. And that in itself can actually, of course, be disruptive for bed partners as well, as you can imagine. But it is actually really life-saving. So
there are, but you said, before I said that, there are smaller things that you can wear and use.
Yeah, well, the things that what they will do is they'll probably give you like a wearable, like either a watch or something you can put around you to try and measure your sleep and actually to see if you're having these dips in your breathing. Right. And if they say, yes, actually you are, it looks like you're having these little apneas where you're stopping breathing, then they will suggest treatment. And one of the most common ones is, as you say, the Darth Vader mask. But they are improving all the time. Don't be put off. But it is actually...
I'm sorry. But then actually, that being said, my cousin who snores, she was given just a mouth guard to stop her from doing that, to put her jaw back in the right place.
Yeah, there's these amazing mouth guards that you can get now. That's another thing that you can do. There's these kind of things that change the shape of your mouth, your jaw, and then your throat. To sort of improve how much oxygen you have. There's a difference between the mouth guards, which are used for things like grinding in your mouth, but also there's something else called a mandibular advancement device, which is all about repositioning your jaw, and that can be used for mild sleep apnea. So you'll be using different devices for different things. But there are all sorts of lifestyle things that you can do as well. And I would say that if you are a bit overweight, actually losing weight can actually have a really big impact on that as well. So that's something to keep in mind. And there are some organisations that can help support that. And the BSSAA have information that can be really helpful for that. But, I think you were saying about the hormonal changes, and I think it is something to really be aware of, especially for women, because what tends to happen is you've got this period between your 40s and 50s generally before the menopause hits. So average age of menopause is about 51 in the UK, and during that time you get these massive fluctuations in your female sex hormones. They go up down as they're kind of petering out. And during that time, one of the biggest things that people talk about is the disruption to sleep. Most commonly, you hear that people are getting up at 3 or 4 in the morning and not being able to get back to sleep. That's the really, really common one. But also people who are then going to bed at night, or even before they get into bed, kind of conking out on the sofa after having a glass of wine and their feet up on the sofa. And the problem is that I think we get sort of almost out of sync with what we know is good for our body and what's good for our sleep. But the vasomotor symptoms, these are the symptoms like the hot flushes and the night sweats. These are kind of dysregulation in our body temperature, essentially, that comes when you see this dysregulated hormones. And what we tend to find is that actually, when you can stabilize that, it can make a massive difference to sleep. So that's a really good thing to kind of keep in mind. But actually cooling yourself down in the middle of the night is a really brilliant thing that can often enable us to get back to sleep, because often we need our core body temperature to drop by 1 to 2 degrees just in order to fall asleep anyway. And of course, if you're having a hot flush at 3 a.m, it's going to wake you up, isn't it? And then it's going to be really hard to get back to sleep. And if you've already been dozing on the sofa at 8 o'clock the evening before, you've probably almost used up your kind of sleep juice. We call it sleep pressure or sleep drive. And then at 3 a.m, it's really hard to get back to sleep, and it's so distressing. But that's one of the things I think to watch out for if you feel like you're having menopausal symptoms which are actually getting in the way of sleep.
Yeah. What about men? Because they drop in testosterone, don't they? So do they suffer from the same thing?
Well, we know that it's not so much that the male sex hormones and the fluctuations in those as you get older have a massive impact on the sleep. We don't tend to think it's to do with that mechanism. But what we do see happening a lot is that, sadly, over the age of 55, we know that sleep quality for both men and women just starts to drop. And so what we see is sleep becomes more fractured, and we end up waking up more. Yeah. It becomes less refreshing, and generally we get less sleep. And if anyone tells you, oh, but people when they're older don't need as much sleep, what they really are referring to is the research which shows that actually we just get less sleep when we get older.
So we do.
I don't know. We probably do need the same sleep, but we don't get it because of our neuronal degeneration, essentially. And it's really annoying because I see lots of people who say, you know what, I've always been such a good sleeper, and then I got to my sort of late 50s, early 60s, and I just couldn't sleep for the sort of 7 or 8 hours that I was used to. And we as sleep clinicians tend to say the same thing, which is, you know, it's about changing your expectations when it comes to sleep as well now, because you're not going to be getting those long hours of sleep. And don't wind yourself up by feeling frustrated that you're not getting that sleep. Just it can be more helpful to almost get to a place of acceptance. This is what it is now. I'm not going to get those like 9-hour stints that I used to, but it's okay. I'm still getting enough to feel good enough, you know.
And do you encourage napping?
Oh, that's a good one. Well, napping is amazing. And yes, I think napping can be brilliant. Even just a 15-minute nap.
Yeah, the power nap. Because actually, if you do anything, they say if you do, and I know from experience, if you do more than 20 minutes, you tend to feel really bad. I feel like really groggy, and it takes me forever to wake up from a nap.
That's it. Half an hour, they say, is almost the maximum you can go to, because you're absolutely right. You then get something called sleep inertia, which is where you almost get a kind of groggy feeling, and it's almost not worth it. You know, when people say, "Oh, I felt worse after my nap than I did before," but yeah, if you can have a 20-minute nap, 15 to 20 minutes, that is perfect, because you actually improve your cognitive functioning, and it doesn't disrupt your sleep at night, hopefully. And also, you know, it's just brilliant, isn't it? Who doesn't love a little nap?
So fantastic. Yeah. So we can nap during the day and start cocktails at 3.
This is it.
Brilliant. I love it.
Exactly.
Love it.
There is only one. There's one caveat with the naps, which is just that if you are someone that really suffers with your sleep at night, sometimes napping in the day can just make it harder to fall asleep at night, or make it so that, you know, you wake up a bit more at night. So it's just keeping an eye on that you're that you're not napping too much. You know, if you're having like a 3-hour nap every day, that it might affect your sleep at night.
Definitely affect it. No, I was thinking the odd power nap would be lovely. Yeah, it'd be
definitely,
really nice.
Definitely.
So the British Snoring and Sleep Apnea Association have actually put out the hidden costs of snoring and not sleeping, go in the financial hidden costs as well. So it's like they reckon that it's £5,000 a year per person on stuff that we do, which is I have done, because all my listeners know I don't sleep very well, but I have done. So we've changed the mattress. That didn't work. So then we changed the topping, and then we changed the pillows, and I do spend money on things to help me sleep. And then I probably do spend, I'm not a massive go out and get a Starbucks coffee, but I do spend money on coffee and then extra bits like, vitamin D, all that stuff. So they reckon that totals about £5,000 per person a year.
Yeah. I mean, it's so much, isn't it?
And it's scary.
It's big industry now. And, I get asked about this quite a lot. So journalists sometimes are reviewing products and they ask me to kind of have a look at them and sort of comment on if I think they're helpful, And some of the time I look at them and I think, gosh, that's not going to work. That's not going to touch the sides. And then at other times you kind of think, actually, that really, really works. You know, I can see how that would be really helpful. So, I think that it's also big business. And I think what's really difficult is it's difficult to know when you see so much on offer. Yeah. And I think often we do just want a quick fix, don't we? So one of the things I get asked about a lot is like gummies or supplements,
Magnesium.
Magnesium, yeah. And the thing about magnesium is, magnesium is good for all sorts of things, right? And in terms of the impact on sleep, there's actually some really variable research. And I would say that, yes, it does look like it probably improves sleep, but up to about 15 minutes, generally, it's not seen to be something that's going to really transform sleep. And so what I would say is that if you are someone that struggles with sleep and you're sort of finding that you're awake a lot in the night, you're struggling to stay asleep or you're struggling to fall asleep, magnesium is probably not your first port of call. It's probably something like a more evidence-based technique like CBT for insomnia. So we often call that CBT-I, and that's a brilliant thing that you can access. And you can get apps that are really good for that, like Sleepio is a really good app. Sleepful is another good app that you can access. And, these are really helpful ways of changing your behaviour and how you... and almost like that sort of retraining yourself in terms of sleep, because I think we get out of good habits and we sort of fall into bad habits, really. So that can be really helpful. But, I get asked about all sorts of things. One of the things I was asked about a while ago was the Sleepy Girl mocktail.
Oh, what's that?
Well, they'd worked out that there's these foods that you can eat that improve the or increase your amino acids that go into the kind of melatonin, the sleepy hormone. So things like kiwis and almonds and tart cherries, and they put them all in like a smoothie.
Yummy,
it does sound yummy, and I think, well, why not? But unfortunately, it doesn't really matter if you're increasing that. It doesn't tend to do much in terms of your sleep. What I would say though is that melatonin is one thing that I do get asked about quite a lot, because you can access that in the US just by buying it in the pharmacies. Again, I would say that most people with a significant sleep problem, you'll probably take some melatonin. You might think, I don't think this is really touching the sides.
No, I did that. And
did you try it? And
and also, I mean, you're not supposed to take it for very long either, are you? Because it will disturb your natural melatonin. So,
well, yeah. I mean, there's different advice with it. So in the UK, we can't buy it in the chemist, but you're not usually prescribed it unless you're over the age of about 55, funny enough. So we know that over the age of 55, our melatonin levels start to drop. But before that, there's no real point in taking melatonin. And I would say for anyone like yourself, if you have taken melatonin and it just hasn't worked, you are not on your own, because it's not powerful. It's not like a sedative, do you know what I mean? That's going to knock you out. And I would say it probably would be better to go down the sort of evidence-based route of things like CBT-I. Yeah.
Yeah, absolutely. Oh my God. So we're doomed, Captain Mannering. We're doomed. So
well, you know what? It can feel like that. But I do also think there's lots of things that, that can bring us hope. And I do work with lots of people with sleep problems, and I would just say that it can really get better. So, I think there's lots of things you can do, and there's lots of support out there as well. And
well, that's it. There's lots of support. Yeah. And it's where you go to find the support, because we are once you once you start looking, then you are bombarded with social media stuff about stuff. You genuinely don't know what's right. So it's sensible to start somewhere like the BSSAA, the British Sleep BSSAA, British Snoring and Sleep Apnea Association, which I will put the link in the bio. But they've got a test so that you can take that. And their disclaimer is that obviously if you are really suffering, then you should seek professional advice. The professional advice could come from you, the Good Sleep Clinic, so I'll put that up there as well. But what they are looking at in this Stop Snoring Week is the financial costs and the hidden costs of the relationship breakdown, mood, anxiety, depression, all of those things that can come alongside sleep. And to know that you're not alone is good, and to know that there are people out there that can help is also very good as well.
Yeah,
I
agree. I think you're absolutely right. And, it's a very lonely place in the middle of the night when you can't sleep. And I think that actually, the more we know about it and the more we can seek help. Yes. Yeah. And like you say, at the Good Sleep Clinic, which is the organisation that I am director for, we see so many people with sleep problems, and I sometimes wish that I could get everyone together so they could see each other, because there's so many people who are in the same position. And even just, I think, sort of looking out of your window at night, you'd be amazed at 3 a.m. how many other lights you might see on. It's such a big problem. So actually, you're very much not on your own, and do look at the support and the materials out there, like the interactive sleep test could be a really good. But actually, I think snoring is a really important one to kind of focus on, and I'm really pleased that there is this National Stop Snoring Week, because, like you say, it can have a real implication in terms of relationships, but also on your health as well, because it can indicate that there might be some kind of obstruction in your breathing. So it's really good to get it checked out.
Brilliant. So is there anything that I haven't asked you that I should have asked you?
I don't think so. I think we've covered a lot, haven't we?
We have covered a lot. And what I might do is, if it's okay with you, what I will do is I will contact you about me, and let's look at my sleep, because that's definitely menopausal and then influenced by stress or whatever. But that would also help women of my age.
Absolutely.
And I'm nearly 64. So women of my age who are post-menopause, who are still suffering from that and all the implications that go with it. But right now, we are looking, a couple of days before Stop Snoring Week starts, we're looking at the actual effects of sleep apnea and snoring that yours or your partners can have any effect on you. And I will put all the links possible to all the to you and to the British Snoring and Sleep Apnea Association in the bio. And Dr. Maja, thank you so much for joining me. I've had a lovely time. It's just flown by.
Me too. It's been lovely. Thanks so much for having me, Jo.
You're very, very welcome.